afternoon, everyone, virtual colleagues. I hope you all had a good lunch, good including the healthy aspect of it. We will not stop emphasizing that today. Yeah, so in our morning sessions, I think we've learned a lot, acquired a lot of technical knowledge, gotten a background on what the burden of nutrition-related NCDs is globally within the country, gotten an indication of the role that different stakeholders play currently in contributing to prevention and curative interventions of NCDs. Then we got a bit of technical expertise on nutritional labeling, how WHO thought about it, what it's based on, especially front of pack. I think we saw some examples of the type of nutritional labels that different countries use. I think some good discussions also came out around restrictions on marketing, and as I noted before, we shall be holding a subsequent sensitization focused specifically on restrictions on marketing. So you can start to note that in your calendars. But yeah, now we get into something that Zachariah noted is one of the most important driving factors, and that's enabling legal and policy environment. So I'd like to first invite Dr. Maurice Odwor. He'll give us a very comprehensive overview of the legal and policy environment that is connected to, using nutritional labeling as a policy tool to promote healthy diets. And the main objective of actually getting, I think as Immaculate and also Heshimiwa noted before she left, is that if we within the room don't know, how can we expect the mama mboga, the kiosk owner, the person in the supermarket to know? So it's within our capacities to actually learn about it, understand how we can use existing legal and policy tools to advocate for nutritional labeling, understand the gaps that need to be filled, and see what role do we play in ensuring subsequent laws and policies actually cover those gaps. Sawa sawa. So, Dr. Odwor, the floor is yours.
Thank you. Thank you for that introduction and for the opportunity to do my very short presentation on legal and policy frameworks on nutritional labeling in Kenya. When I was sent the invite asked me to look at legal and policy frameworks on nutritional labeling in Kenya, the gaps and recommendations. But I thought that I do not want to look at the legal framework in the context of gaps because of several reasons, and we shall see that very shortly. Now, previous presentations may have created the impression that perhaps we are in a position of weakness insofar as the law is concerned. My submission is to the contrary. I think we have a very robust framework of law. It just depends on how we use it for purposes of nutritional labeling, and particularly insofar as the advancement of health is concerned. If you could just go to the next slide. We have a very robust framework that is centered around the concept of the right to health. And as far as I'm concerned, this is something that can be interpreted in any number of ways. For purposes of advancing the health of our people. And if it is binding the government in the context of nutritional labeling, within the context of the law, I think that is something that is possible. It's something that can be done. And if you look at our constitution recognizes international law as part of our legal system. And we have instruments which we have both ratified and which actually have acquired what in law we call the status of custom. And a good example is the Universal Declaration of Human Rights. It provides for the right to the highest sustainable standard of health. If you look at the second instrument, the International Covenant on Economic, Social, and Cultural Rights, it also provides for the right to health. Next slide. The other instrument is what we call the Convention on Elimination of All Forms of Discrimination Against Women. It also has very robust provisions in relation to the right to health. And if you look at the more specific recommendation under that convention, it makes a very specific reference to the question of nutritional well-being of women. Next slide. When it comes to children, we also have a very robust international legal framework. The Convention on the Rights of the Child, it gives us very foundational principles that I think can be interpreted in a very broad manner in such a way as to provide for the protection of the right to health. Remember, the reason why we are here is that we are talking about nutritional labeling and nutritional labeling in the context of the right to health. And so it is very possible to interpret some of these provisions in such a way that they can be extended. If you look at, next slide please. If you look at a very specific instrument under the Convention on the Rights of the Child, it is known as General Comment number 15 on the right of the child to the enjoyment of the highest attainable standard of health. It is also very specific. It has got very specific provisions. For example, it requires the state to address things such as obesity in children. And so if you are required to address things such as obesity, to the extent that nutrition labeling may be one of those ways in which that can be used, then to that extent, my submission is that we have a good framework that can actually be used. Next slide. Now, what we have just looked at is just a few of the samples. There are quite a number of other international instruments. Some of them are what we would call hard or binding law. Some of them are what we would call soft law, but all of them contribute towards the attainment of the right to health. Now, the United Nations has clarified on the right to the highest attainable standard of health through a document known as General Comment number 14. And if you look at that General Comment, it's a very big document. If it is read purposely, as far as I'm concerned, I think that document can also be used to enforce certain obligations relating to nutritional labeling. Next slide. There are various other mechanisms within the international law system. For example, we have a system known as the Special Rapporteur. Special Rapporteur can clarify the obligations of the state in international law. And we have a number of those documents that have been done. One of them being the report of the Special Rapporteur on the right of everyone to the right to the enjoyment of the highest attainable standard of health. It provides guidelines in terms of what the state is supposed to do in the context of NCDs. The next document is specific to nutritional labeling. It is known as the Statement of the UN Special Rapporteur on the right to health on adoption of front of package warning labeling to tackle NCDs. I think it can never be more specific than that. And it states very clear obligations on the part of the states with respect to nutritional labeling. Next slide. Now, besides international law, we also have instruments that are closer home, in the sense that they are developed within the context of the region. The key of those ones would be the African Charter on Human and People's Rights. If you look at Article 16, it has very clear provisions on the right to health. And those provisions of the African Charter on Human and People's Rights have actually been interpreted by the interpretive body under that treaty, which has recognized the inseparability of the right to health from other human rights. For example, the right to food, human dignity, education, work, and political participation. So it's a very broad document. Next slide. Under the African Charter, there's a document that is specific to women. And it is known as the Protocol to the African Charter on Human and People's Rights, or the Maputo Protocol. If you look at Article 14 of that document, again, it provides for the right to health, specifically with respect to women. And then there's the African Charter on the Rights and Welfare of the Child. Again, it provides on the right to health with respect to children. And there has been further interpretation of its provisions under the African Committee of Experts on the Rights and Welfare of the Child, where it has been said that a child's right to health is very broad. It encompasses the right to food, water, development, and so on and so forth. In other words, it is an all-inclusive right. Very close at home, insofar as Kenya is concerned, we have the Treaty for the Establishment of the East African Community. This treaty provides a framework for collaboration amongst the East African states. And one of the areas in which states are supposed to collaborate is with respect to consumer protection and promotion of health. To the extent that nutritional labeling is an aspect of consumer protection, as we shall see very shortly, then to that extent, that treaty can also be used to extend obligations insofar as the nutritional labeling is concerned. So, on the one hand, we have international legal framework and the regional legal framework. Next slide. Now, all these frameworks, to the extent that they are broad documents, and to the extent that some of them may not necessarily be providing for nutritional labeling, these documents are supported by existing global policy frameworks. And all of these global policy frameworks can actually be read into the provisions of the treaties, the provisions of international law, and so on. And I think we are all familiar with all of this: the global strategy on diet, physical activity and health, political declaration, and so on and so forth. So my submission is that all these documents, all the policy statements that exist at the international level, particularly within the context of the UN, the World Health Organization, all these documents are documents that can be read into the provisions of the law with respect to the right to health. Next slide. But more specifically, those ones were general. More specifically, we have very specific instruments that deal with nutritional labeling. And to the extent that they are specific, it becomes easy to clarify what the obligations of the state are concerned, what are the obligations of the state in international law insofar as nutritional labeling is concerned. And so we have, earlier on in the morning, we were taken through the Codex Alimentarius, which is developed through the Commission. And the guidelines that have been issued under the Codex Alimentarius Commission can actually be used to clarify or to interpret the obligations of Kenya insofar as nutritional labeling is concerned. Next slide. The other documents, for example, the Rome Declaration, as well as the UN Decade of Action on Nutrition. Again, these are documents that further clarify what the obligations of the state are in international law. Next slide. The voluntary guidelines on food systems and nutrition require the states to develop systems that will enable safe and healthy diets. Now, to the extent that the state will be required to at least chaperone a system or develop a system where producers of food are required to label the contents of those food, then the voluntary guidelines on food systems provide further clarification in terms of the obligations of the states. Next slide. We also have a regional policy framework. There are many, many instruments. I need not, we don't necessarily have to go through all of them, but those are the few examples that are there. The Brazzaville Declaration, the African Health Strategy, the Social Policy Framework for Africa, Agenda 2063, the Africa We Want, all these policy documents have got specific provisions in relation to the right to health, and which can be drawn upon by those of us who are involved in this work in order to clarify what the obligations of the state and the obligations of the various players are concerned, at least insofar as nutritional labeling is concerned. Next slide. So having looked at the sort of overarching international legal policy framework as well as the regional legal and policy frameworks, what do we have here locally that can be utilized? And the first port of call is the Constitution. Our Constitution provides, it guarantees the right to life. Now, if you look at certain other instruments and certain other judicial determinations, the right to life has been interpreted in a very broad way, to such an extent that it includes the right to health. And so, if third-party players in the food industry behave in a manner that they prevent citizens from making proper decisions in terms of the kinds of foods that they will consume, then it is possible to hold them to account within the context of that article. But more critically, and more specifically, we have Article 43 of the Constitution, which provides for the right to the highest attainable standard of health. That is a very broad formulation. If you unpack Article 43, you'll find that it is very possible to hold to account players in the food industry who jeopardize the right to health of our citizens within the context of the foods that they put in the food chain. Article 46 makes provision for consumer protection. People who consume food are consumers, and that is protected as a constitutional right. And we shall see just down here, there is also a statutory framework for consumer protection, which can also be called upon to extend protection to consumers in the context of the food that is consumed in this country. Most importantly, under the Constitution, we have the concept of limitation of rights, where a court can determine how to limit rights or how to restrict rights. And the trend has been, well, not necessarily the trend, but it is possible to make an argument for a court to restrict a commercial interest in favor of an interest that advances the right to health. And we have seen that if you look at those of us who are familiar with the BAT versus Attorney General decision, we saw that is a case where the High Court, actually it went to the Court of Appeal, I think, if I'm not wrong, and the courts upheld the right to health as against the commercial interest of the companies that were involved in the production of cigarettes and who are challenging certain regulations that were meant to enhance the right to health. Having said that, also, I should also mention very quickly that insofar as our Constitution is concerned, our Constitution is a very broad document that is steeped in the culture of respect for human rights, in the culture of respect of social and economic rights, in the culture of respect of the right to health and so on. So within the general framework of the Constitution, it is possible to make arguments that will advance or at least will protect any regulations relating to nutritional labeling as far as they advance the right to health. The other important piece of legislation is the Children Act. It is the controlling legislation when you talk about interest of children. And it advances the principle of the best interest of the child. In other words, any decision that is made, including decision as to how you either package or how you label your food products, as long as that decision goes against the best interest of the child, it is possible that that decision as long as that decision goes against the best interest of the child, or as long as it can be interpreted to be an affront to the right of the child to survival or to life and to development, then that decision can actually be struck down. And we have seen that in a number of cases. But more importantly also, that very act also provides for the child's right to health. And in the context of the Constitution, in the context of the international and regional legal framework, it is clear that the child's right to health is actually protected, and it can actually be interpreted in a way that it binds the decisions of industry players that affect that child's right to health, including decisions relating to nutrition labeling. Next slide. As I said, besides the consumer protection under Article 46 of the Constitution, we also have a specific legislation that deals with consumer protection. And its purpose is to protect the welfare of consumers, specifically against unfair, unjust, improper trade practices, including deceptive, misleading, unfair, or fraudulent conduct. So that the labeling of a food package that is misleading would be a labeling that is actually proscribed by the Consumer Protection Act. In addition to the fact that it requires, or at least it creates, the obligation to create consumer awareness and sharing of information. The Food, Drugs, and Chemical Substances Act, the one that we are attempting to amend, despite its perceived other flaws, however, it provides a very general framework that can be put to bear in the context of nutritional labeling. And that legislation also has got rules that are made under it, and these rules can be used to compel industry players to behave in a particular manner in the context of nutritional labeling. We also have the Breast Milk Substitutes Act, Regulation and Control Act, which provides for labeling of foods that are said to be complementary or designated in that act. And insofar as breast milk substitutes are concerned, those are covered under the Breast Milk Substitutes Regulation and Control Act. And the provisions of that act actually codify a code, the International Code of Marketing on Breast Milk Substitutes. And all of this can be brought to bear to industry practice in the area of breast milk substitutes. Next slide. We have a very new piece of legislation. It is what? It is 4 years old. We are still implementing it. We are going through the motions of implementation. It is known as the Health Act. It is a very broad piece of legislation because it implements Article 43 of the Constitution in the context of the right to health. And as far as I'm concerned, the provisions in that act can actually be brought to bear to define nutritional labeling obligations and even to hold to account people or industry players who violate those provisions. And finally, from a general point of view, is the Standards Act, which provides for the creation of standards, and it is within the context of this that we have some of the examples of standards that I used. 38/2014, a standard on labeling of prepackaged foods, and these are it is in the context of this Standards Act that the Kenya Bureau of Standards adapts, those guidelines and requirements insofar as labeling of foods is concerned. Next slide. Besides the statutory and the constitutional framework, we also have a policy framework. The general trajectory of the interpretation of the Constitution by our courts is that nowadays they incorporate policy statements in the context of interpretation of constitutional provisions. So all these policy statements, for example, the National Strategy for the Prevention and Control of NCDs, to the extent that it has provisions that can actually be brought to bear in the context of nutritional labeling, then all those policy provisions are important. Kenya Health Policy, running between 2012 and 2030, has got very specific provisions relating to non-communicable diseases, and all these provisions can actually be brought to bear in the context of nutritional labeling. Next slide. The National Nutrition Action Plan 2012 to 2017, it looks dated. I don't know whether we have an updated one, but even then, it provided a roadmap for certain measures that the state could take in the context of nutrition. And if there's an updated one, it can still be brought to bear in the context of nutritional labeling. Then you have the National School Meals and Nutrition Strategy. Again, it binds the various players to focus their energies, or to at least to make decisions that promote nutritious food consumption amongst school-going children. Next slide. The national guidelines for healthy diets and physical activity, again, has got provisions that are geared towards promotion of healthy diets in addition to physical activity. But if you look at the objectives, 4 out of the 5 have got something to do with healthy diets. And so all of this can actually be brought to bear in the context of nutritional labeling. Next slide, which is the final slide. Now, I know it has been said that we may not be at a very good place insofar as standards of behavior are concerned in the context of nutritional labeling. That may be so, particularly in the context of the fact that we are still developing the front of labeling regulations and policies. But from a practitioner's point of view, I do not think that we are in a bad place. We have the basic building blocks for developing very binding obligations in the context of nutritional labeling. So the question then is, as we await the ministry to give us specific determinations, specific instruments for nutritional labeling, what can we do with what we have? And I think we have an opportunity. First of all, in the context of the right to health, we have an opportunity to utilize the provisions of the right to health, because, as we said, these are provisions that can actually be interpreted in a very, very broad manner, as we have seen. And even the policy documents provide what you may want to call the flesh of that can be used to fill up the bare bones of the constitutional provision. So But why are we not doing that? What are the issues? And I'm hazarding that stakeholder coordination may be minimal. The area of NCDs is now beginning to emerge as an area of concern. 20, 30 years ago, we were all communicable diseases, TB, malaria, HIV. It appears we have at least stabilized that area. And so we are now beginning to shift our focus. And now in these early stages, there's very minimal stakeholder coordination. How do we resolve that? By holding events such as this, by having institutions such as IDLO, the World Health Organization, IDRC, bringing together players in this sector so as to have discussions in terms of how to proceed. But in addition to that, it appears that we have information black holes or data black holes. In other words, where is the evidence? Where is the evidence, for example, that that front of label packaging helps or at least advances the right to health? We may be familiar with it, it may be somewhere, but the players in the industry, the producers of food, don't want to hear that. And so what they do is that they sponsor certain other forms of research to counter this narrative. And so in order for us to deal with them effectively, because if they go to courts to challenge, for example, a requirement to have certain forms of labeling on their packaging, and they say there is no evidence, and then the court will ask you, so you are saying doing this is going to improve the right to health. What shows that that is the likely outcome? And you do not have that evidence. And the industry has spent money to develop a narrative that actually counters what you are saying. Quite likely, the court will not listen to you, most likely. The other thing that I see as a problem is that we are so compartmentalized as disciplines. You know, we lawyers are saying, you know, we are the lawyers, so we can speak jargon better than so-and-so. The doctor says, I'm the doctor, so I know things about health. Researchers, scientists say, but I'm the one who has done the empirical study, so I have the facts, so I know. And so we sit in our small little cocoons having what I call incestuous conversations amongst ourselves in our own small little boxes, little disciplines, refusing to share our expertise and refusing to share the information that we have and refusing to share our ideas. And because of that, therefore, our approach towards the use of the opportunities that exist in the law becomes very fractured. A lawyer will say, but the Constitution does not provide for certain things. And yet, if you just talk to your doctor friend, they will give you certain information which you can use to plug in the gaps that you have insofar as for example, your case is concerned, and so on and so forth. Someone said earlier on, I think it was the participant over there, I can't remember her name. She asked, are we just having these conversations here in these conference rooms? Once we are done here, what next? Will Kelleen call us in the next stakeholders forum and then we talk about the same things? And Immaculate asked, if we as the people who are in this arena ask certain questions and appear not to have understood certain aspects, how is it for that so-called mama mboga down on the street? For example, how do you talk to my grandmother about what is it called, the alimentarias? How do you tell my grandmother, there's the Codex Alimentarius, and so on. And yet she is suffering from diabetes, for example, or high blood pressure, and so on. So in other words, how do you connect that problem that she has with all the discussion that you have? And so there is need for us to take the discussion down to the ground, down to the community, particularly in the context of one of the pillars of this government, the UHC, Universal Health Coverage, and also particularly also in the context of community health, because community health is also big it's a big policy objective of this government. Finally, and I know there are many other issues that we could talk about, I'd be happy to discuss them with you if they come from you. But what capacities do we have? What are the capacities we have to use what exists? I can tell you for a fact, lawyers, very many lawyers, do not understand Article 43 of the Constitution. They don't. And they are not willing to take that extra step because it's a lot of reading. I can tell you, Article 43 of the Constitution, the right to health, the right to the highest attainable standard of health, is a lot of research and reading on its own, without even having to talk about non-communicable diseases. A good number of our lawyers are engaged with bread and butter issues. You know, where will money come quickly? Where will I make that money quickly? But if you tell me about Article 43 of the Constitution, something that some of our courts also do not understand, then most of our lawyers are not willing. So what are we doing in terms of building their capacities? Public health practitioners, how many of them are exposed to the discussion that we are having, for example? That the discussion that certain public health issues are actually legal issues. That besides the clinical issues that are presenting before you, there may be certain other policy issues, and that you may have a role to play in terms of developing those policy issues. So what do we do? One of the things that has happened is this program, RECAP. I think and if you look at one of the objectives is to enhance the capacity of civil society, academia, and other professions in the context of non-communicable diseases. And I think that is the way that we want to go. One of the things that has been done, or one of the gaps that was recognized, is that for our professionals, the lawyers, the public health officials, and so on, they are not exposed. They do not have the capacity to interrogate and to take advantage of the systems that we have. And so one of the things that has been done is to develop materials that address the legal and policy frameworks for non-communicable diseases. And there's a document, there's a book that we call the toolkit the toolkit on legal and the toolkit on regulatory and physical approaches to non-communicable diseases in East Africa. It is almost being finished. I hope that when it is done and when it is published, we shall be able to share it amongst ourselves so that we see what is it that we can learn from it. But the critical purpose of that tool is to enable our academics to teach our students these issues that we are talking about. Because our students who are getting into the profession are getting out without the critical tools and the skills and the knowledge that will enable them to advance and promote the right to health, and also the prevention and the prevention of non-communicable diseases. Finally, as I conclude, I think there is room for us to do things as we wait for the government to move in the pace at which the government usually moves, in our own individual spaces and in our own professional spaces. We can actually do certain things. Let's do those things. Thank you, ladies and gentlemen.
Thank you very much, Dr. Odor. I think you did a good job balancing the legalese and reminding us what really the main point of the presentation is, that there are legal and policy frameworks at the global, regional, and national level that we can utilize to push even as other initiatives or interventions or government-led interventions are ongoing. So there are some comments on the chat on the virtual platform from Veronica from the Division of Non-Communicable Diseases. Veronica notes that currently we're implementing the Kenya Nutrition Action Plan 2018 to 2022. Then from Kate Robertson from WHO, a comment stroke question. She notes, generally speaking, neither government legal commitments which may be binding, neither government legal commitments which may be binding on the state, nor government policy are legally binding on corporate actors unless they are mandated by legislation or regulations, i.e. a law, are applicable to corporations. Is this the same in Kenya, or is there some mechanism that requires business actors to comply with government policy decisions? As noted, there are legislative mandates for government to regulate, to e.g. implement front of pack labeling or strengthen existing labeling standards, but new or amended standards or regulations are required to regulate corporate behavior. Kate is really interested in hearing more about the mechanisms available in Kenya to realize rights. So I don't know, Dr. Edward, if you want to comment on that. It was quite long.
I got it. Thank you for that intervention, Kate. I think one of the very unique aspects of our constitutional framework is that we have stated very specifically that the provisions of the Bill of Rights bind not just the government, but also private actors. And so in that context, and I've argued in other fora, that even obligations relating to the right to health, those obligations bind non-state actors. And so it is possible to have discussions around issues to do with nutritional labeling. And if you relate nutritional labeling to the right to the highest attainable standard of health, then it is possible to make out a case that where a private entity, a commercial entity, is engaging in packaging practices that appear to have certain consequences within the context of the right to health, then it is possible to hold them to account, at least within the context of the Bill of Rights. I think so.
Yes.
That is one. Two, we have a system of law that is known as tort, the law of tort. And there are some other jurisdictions where it has been argued that, well, if you are producing something that is meant to be utilized by members of the public, and you do not give them information, maybe it has got certain ingredients that are not, healthy. They're actually harmful. They've been found to be harmful. Then it is possible to hold those producers to account within the context of the law of tort. So not just the Constitution, but also within the context of the law of tort, the law of negligence, consumer protection, and so on and so forth. Granted that some of this action will actually go beyond the state. For example, if you're talking about the law of tort, these are private right mechanism. And so it will take the individual who has suffered the harm, to take the initiative to go to court and hold that private entity to account. So we are not 100%, but we are not 0%. There's something that you can do. Thank you.
Thank you very much, Dr. Odwor. I see Steve has, I think, other than Steve, are there any other questions? I can see Rahab and Steve. Sure, let's start with Steve and then move to Rahab.
Yeah, thank you very much, Dr. Odwor. Mine is just a clarification. There was a document you spoke about that was launched in February 2021. So I would like to understand, is it a guideline? Is it a policy? What was that was launched in February 2021? Having said that, I'm trying to look at LISA, looking at where do we come in with issues of IP when it comes to, I know there are some foods that are drugs. So I'm looking at where are we coming in terms of IP when it comes to TRIPS flexibility when we connect the board, because all of them are supposed to be labeled, and at some point you might get a production company telling you that according to their patents issues, they are not able to disclose some of the formulas. So I think that is where we brush between the legal guys and the production guys, and then the ministry comes in. Thank you.
Thank you for that, Steve. I'll let Rahab.
Yes, thank you. I have 3 points to bring on the legal issue. I referred to the Tobacco Act of 2007, where we have a product called Lyft, L-Y-F-T, and the manufacturers, during COVID, when we were at home, tried to push it as a list of essential commodity. You can imagine cigarette is an essential commodity. And they tried pushing it to an extent that they even, you remember the COVID National Task Force? They contributed a lot of money for COVID-19 response. When I did my marketing course at Kenya Institute of Management, I was told one of the way to entice your customers is through marketing. So you are there on national TV, contributing through CSR, but what are you trying to promote? Something branded for tobacco. Another thing they tried to do is to push for opening up of the Tobacco Act to accommodate the new emerging products. If they dictate that the act is rewritten, they wanted to bribe lawmakers. I wish they were here, I would have said it. The health committee, the finance committee, and the ones who are responsible for regulatory. And I think we do not have limitation of laws in this country. We need to ring-fence some of these critical things. Because if you look at tobacco smoking, somebody said people get cancers because you're in a bar, you're exposed to somebody who is a smoker. You're a second recipient of the smoke. We need to reinforce and ring-fence some of these policies that we have in this country. Otherwise, as much as we want to expand more, we will be tied by the law. And these days, many Kenyans don't want to keep going to court. Even financing for us to do the advocacy work is very limited. And as I said before, the manufacturers have a lot of money because they are profit-making. Thank you.
Thank you very much, Rahab. Unless there are any other questions. Okay, so Dr. Odwor, if you could comment on those. Oh, one here from Dr. Mwale.
Yeah, I think just before he goes, before he responds, I would just like to mention something that every business person, if you're interested in doing business in Kenya, then you know the biggest nightmare is how many licenses you have to get. So I want to say that we have too much regulation. Kenya is overregulated. So every sector tackles their issues from a sectoral dimension. So you'll find that when you go to health, they take care of the health issues. When you go to environment, they do the environment issues. Land the same, agriculture the same. So everyone aligns to the international, regional, national policies and conventions. So I think Kenya, in terms of legislation and regulations, we have enough of it. The problem lies in the extent at which we implement. How much do we implement or enforce this legislation? I think we should not say that we are 90 or 80%. We have enough regulation. Even for the corporate, policies are meant for both government and the private sector. Even legislation are supposed to be applied in the same environment where the government and the private sector work. So we cannot blame each other. It's just that what is your role? What are you supposed to be doing? Thank you.
Okay, I'm seeing this has sparked a bit of a
I want to go before Peter. Peter was stuck at the FDA. We had been in a discussion for many years on the FDA bill that is currently in Parliament. And if I want to look at the issue of regulatory, the issue is that we need to look at the issue of food, consumer, and the tobacco law, and the trade classification. For example, if you look at this lift, it's a nicotine product, but BAT is trying to promote it as not a nicotine, you know? Yet WHO has come out strongly to say lift is a tobacco product. So when we have this now law, FDA law in Parliament, and we know some members of Parliament are supporting it because they're in consultation with the manufacturer, how are we going to ensure that the law is very strict to ensure the regulatory issues we are talking about, the issues of packaging, are adhered to? I think we need to have a watchdog role on that bill. And I think one of the resolutions from this meeting will be to get that law, that bill where it is, look at it, and give a recommendation as soon as we can. And then we push, if it's a matter of pushing it to be implemented, but with our amendments. Thank you.
Okay, mine is, I think what, I'll allude to what Rahab has said. We had a law, a counterfeit law, issue in Parliament, where the parliamentarians were taken to Mombasa by pharmaceutical companies. And when they came back, they almost passed it. So ARVs was also, what do you call the ARVs, not counterfeit, but they are generics. So generics was lumped, all generics was lumped inside the counterfeit. So which means the pharmaceutical companies had interest. But there's one angle we are not tackling on all these issues, even the NCDs. Nobody is discussing about corruption. Because we have regulations, we have policies, we have everything. But corruption makes it, downs it to water. Thank you.
Thank you, Peter. Before I hand over back to Dr. Odwar to comment on these, I know corruption is always an emotive issue. I mean, it would be. Okay, yeah, Dr. Odwar, I think you can proceed.
Thank you for those interventions. If I could just start with Steve. The issue of IP, intellectual property rights, disclosing the content of your product has got nothing to do with the intellectual property. The framework that deals with intellectual property protects your right to exploit your invention. And so when it comes to foods, the fact that you're required to disclose what the content of the food that you've made is concerned, is made up of, may not necessarily have any implications in terms of your exploitation of your intellectual property rights. But even then, even in international law, in the context of the World Trade Organization, an exception has been recognized that when it comes to the protection of public health, then intellectual property rights can be limited. And that can actually happen even domestically. And there are a number of decisions within the context of the World Trade Organization which have said that public health can be used as a limitation of intellectual property rights. And so there are arguments that can be made, and it all depends on the facts of the case. On the issue of the 2021 document, these are voluntary guidelines on food systems and nutrition, 2021. They were adopted by the UN Committee on World Food Security in February 2021. I think the question would be how binding are these? At least insofar as international law is concerned, they may not be binding, but in international law there's a concept, there's a source of law that we call soft law. And when an issue arises that may call for the interpretation of the obligations of the state under the Constitution or even under international law, soft law can actually be used to interpret and to firm up a court's interpretation of a legal provision. So they may not be binding, yes, but they can actually be used for purposes of interpretation. Rehab raised the issue about how I understood it is the question of industry influence, including corruption and whatnot. I can tie that question together with that of Peter. The issue of corruption, yes, it is true. There's a lot of it. I don't know how many of you remember initially when we started to grapple with the question of tobacco control, when the then health minister promoted some legislation, and the members of parliament were taken to Mombasa for, what is it called? What do they call it? They call it workshop. There's a word they used. I don't know, capacity building or something. And then they were seen, in various states of undress, walking and swimming in the beaches. Some of them had smeared themselves with the mud. There's a mud that people smear themselves with. When they came back, to Parliament, that thing never saw the light of the day. And so it is true that there's very serious industry influence. It is true that there's very serious corruption. Do we give up? No, we don't. We use the tools that we have. Sometimes they work, sometimes they don't. But remember, I don't know how many of you remember the case of Kenya Times Media Trust versus Wangari Maathai, where Wangari Maathai had sued the Kenya Times Media Trust to stop them from building a complex on Uhuru
Gardens.
Uhuru Park. The case was thrown out. But the building was never constructed. Why? Because of the publicity that came to that case, and the financials of that project actually pulled out. And so sometimes we make noise, we go to court for the nuisance value of the noise that we make when we go to court. Sometimes you don't go to court to win the case. You go to court to win public opinion. And so in spite of all these challenges, we are not necessarily hamstrung. We can still do things within our competencies. Dr. I don't know, is it Dr. Mwale? We have enough regulation. Well, that is true, and it's also not true. Sometimes when you're dealing with government, and when you're dealing with people with very strong commercial interests, sometimes you want to be very specific. You want a legal framework that is very specific. And when you have a framework that is not specific, then it gives them the opportunity to find little loopholes that they can use to promote their own businesses. For example, the case of Lyft, which you can see clearly BAT is promoting something that is a tobacco product, but they are arguing is not a tobacco product. Why are they arguing that it's not a tobacco product? It's because the law did not anticipate that product. and it takes either a specific provision or a very clear court pronouncement to actually say that this product is actually prohibited. And so, yes, it may be true that you have a lot of regulation, but unless there is that specificity, then you leave some little regal room for these very powerful industry players to joke around with our health, and that's not one. It's not the thing that we want to allow them to do. And the reason why I'm also saying that is because our courts have proven to be, what should I say? They're not necessarily useless. Our courts are not useless. If you talk about that counterfeit legislation, I wasn't aware that there was actually industry participation, that there was industry influence in that law that lumped together counterfeits and generics. But I'm sure you know the story. Someone went to court. Was it Patricia Acero? She went to court, and she got it declared unconstitutional. Yeah. And so, industry will always do what industry will do. But for those of us who are aware of the issues, what do? We take them head on, and we go to court, and we make noise, and we use what we have. We file cases, and we write papers, and do studies, and so on, to deal with them. Thank you very much.
Thank you, Dr. Oduor. I think your reflection on Patricia is the reflection at the end of your presentation. What role can you play? What power do you have in the system that exists? And the Patricia Acero case on the Anti-Counterfeit and Generic Medicines Act, or bill as it was at the time, is a very good example, because at the end of the day, the issues to do with generics were actually removed from the bill, and people continue to access generic ARVs to date. And so none of our tools may be perfect. They may not always be effective in the same way, but that is the reason for multi-stakeholder and multi-sectoral collaboration. Because, as Dr. Oduor said, if we continue to be in our little incestuous relationships, lawyers on one side, researchers on the other, medics on that corner, and we continue to do our work in silos, then we'll never be able to leverage on any collective action. So if there are those who go to court just for the sake of bringing publicity, and communities that contribute to that publicity through protests, and people who lobby through their government connections, then perhaps we can get somewhere. I think we all know, especially as people, those of us who do work in civil society know, that there is no one clear path to an objective. So quite quickly, we'd be remiss to tell you how Kelin is a health rights organization and have no presentations to do with what rights and rights-based approaches are. So if you could kindly put up my slides. I think this will be our last presentation of the day. I'm sure we're tired of seeing PowerPoints, but bear with me, because my aim is always to create one new activist in every forum that I participate in. But I think a thing Immaculate has always said is every 30 minutes you should move, so we should stand. I think we need to stretch a little, even our virtual participants, wherever you are. Stand and move around your desk. Get out of the bed or off the couch. No, stretch a little. You can do head, shoulders, knees, and toes like your children. Yes. Chakula hata digest vizuri, you know? Awesome. So yeah, my presentation, feel free to sit and or stand, whatever floats your boat. I shall not be a dictator like Immaculate. Quite quickly, so rights-based justification for nutritional labeling and recommended policy actions. So you'll see as each of you entered, you are given this document, this policy brief on nutritional labeling, which basically breaks down some of the things that Dr. Odwor noted in his presentation. So what are the existing legal and policy frameworks, whether globally, regionally, nationally, and how can they be used to advocate for nutritional labeling? So this brief is meant to be a tool that people can use to actually, as Dr. Odwor said, sometimes the purpose of having regulations or guidelines or laws can be interpretation, but can also be something you can leverage on as a non-state actor or someone working in advocacy to actually advocate for something. So please, for our virtual participants, we shall share a PDF link with you so that you can also have access to the document, but this is basically what we are looking through. So, quickly, the outline of my presentation, next slide, is talk about, first off, what is this rights-based approaches? If you've been to a meeting by any human rights organization, you have definitely heard this phrase before, rights-based approach to health, rights-based approach to this. So we'll actually define what that means. Then we'll talk about health as a human right. I think there's definitely a gap in understanding what the full breadth of the right to the highest attainable standard of health actually means. Beyond kwenda hospitali and getting a service and maybe under UHC, getting it free or getting it at a reduced cost, is there a broader, like is there more to the right to health than we initially assume? Then we'll talk about, in fact, I'll actually skip that one because we have touched on it, lessons from the HIV pandemic. We've actually touched a bit on it from the Patricia example. Then applying constitutional rights to advocate for nutritional labeling, and then maybe some case law, and then recommended legal and policy actions. Sawa sawa. Higher definition of rights-based approaches. You can see a very long quote there. I'm not going to read through it, but the point of rights-based approaches is the recognition that development, and that includes all these things we know, health, education, social security, food, water, housing, need to be based in international human rights standards, and they have to be directed towards promoting and protecting rights. And that's actually something that Kenya, in theory, does. The longest chapter of our constitution is actually the Bill of Rights. I think it goes from Article 19 to 59. That's 40 straight articles of the Constitution are just outlining rights. So the point of rights-based approaches is to move beyond the idea of having laws and policies just ukuju, and understanding or seeking to analyze what are the current inequalities, what are the current discriminatory practices, what is the current, injustice that exists in our society, and then whether it's legal and whether it's policy making, whether it's programming, whatever it is, having it directed to address that. So rights-based approaches specifically are quite vital because, of course, of the obligation that it imposes to protect, to respect, protect, promote, and fulfill rights, but also they lead to more sustainable and just better development outcomes. Next slide. Yeah, so the principles of rights-based approaches, they're generally called PANEL, as you can see, P-A-N-E-L. So participation, that's why the right to public participation is such a huge thing, and why we're talking about it just earlier today. Because a rights-based approach, states that everyone has the right to participate in shaping decisions that affect their lives, accountability, monitoring of human rights standards, and having remedies when rights are violated. So again, talking about how we have great laws, but those laws are not implemented, or there are rights violations happening due to corruption, what is the response to that other than pushing for accountability? Non-discrimination and equality. I think a good example given was by Anne Swake. I think she stepped out a little, that even if, let's say, we adapt front of pack labeling, how are we thinking about someone who's blind and can't actually read or see that label? Think about the tobacco label or the label on cigarette packs and the fact that there's the picture that anyone can recognize, whether they're literate or illiterate, whether they speak English or not. You see a picture of diseased lungs, you get what's up. Empowerment. A thing we keep saying, are we all going to sit at Sarova Pan-Afric, have a good lunch, discuss, then go, or do we have a role to play in empowering communities and individuals to know and claim their rights? Lastly, legality. Human rights, and this is actually tied to Kate's question in a sense, that human rights are legally enforceable entitlements. They aren't just things we talk about, they're things that are owed to us, that we can go to court to agitate for, or to seek redress if someone has violated. And in Kenya, the Bill of Rights applies to everybody, including corporate entities, including me to Dr. Mwale to me. It applies to all of us. Next slide. So, I mean, we all work in civil society, or not all of us, some of us. Some of us work in academia, some of us work in government. But the main reason we all need to know our rights is, again, if you don't know you're owed something, it's easier to take it away. And so take that lesson from Neo, from the Matrix. And what if I told you it's easier to take away your rights if you don't know what they are? Next slide. And so, health as a human right, or this right to the highest attainable standard of health, what does it mean? So, health is one of these rights that's generally termed as an economic, social, and cultural right. So in the broad human rights framework, there are economic and social rights, and there are civil and political rights. So civil and political rights like freedom of association, assembly, movement, are generally seen as people don't impede on you. Unajua hawakushiki, hawakusumbui and your right to assemble, hawakusumbui and your right to move within, unless with a legitimate reason. But socio-economic rights can be a bit more complex because they require active investment by the state. So to realize the right to health, government has to set up hospitals, actually invest, have a budget for finance. There's no budget for for not impeding on freedom of expression. There doesn't need to be a budget line that we're reading in July. This is the budget to tell people, or rather to stop people from speaking. But there has to be a budget line for health. If there are things to do with housing or having more access to water, there has to be an actual investment by government towards that. And so that aspect of socioeconomic rights and the need to continuously invest in it makes it kind of a contentious, makes those socioeconomic rights contentious and hard to really, push for. Next slide. So this is just a brief overview of how health is defined broadly. So they're the essential elements of health, that services are available, they're accessible, they're acceptable, and they're of good quality. Available means that they're actual, healthcare facilities, medicines, trained personnel who can deal with your things, diagnostic machines, etc. Accessible means multiple things. One, economic accessibility or affordability, a huge issue for all of us. I think one of my favorites Yet most disheartening Kenyan sayings is that you are one health emergency away from poverty. One diagnosis of cancer, I mean, how many mchangas do we see around? This baby needs to go to India, and so we need to raise 3 million Kenya shillings. Even at lunchtime, Timothy was telling me how a friend of his, while he was in KSL, was dragged in a matatu, and he went to Karen Hospital, and the 2 nights he spent there, the bill was 700,000 solidly. He was a student. So economic accessibility, there's physical accessibility that unaweza fika where the health service is actually being offered. There's information accessibility, a very key one to us in this discussion on nutritional labeling, that there actually has to be, as someone noted on the chat earlier, around the issue of Roico cubes and whether they actually have iron or can act as iron supplements, that people do want to eat healthier, but do they have the information on how? On what foods are giving them the nutrients that they need. Then there's non-discrimination, basically that services should actually be accessible to all. Then acceptability means cultural appropriateness, respecting medical ethics, being gender sensitive, etc. Quality is fairly self-explanatory. Next slide. So underlying determinants to the right to health. This is probably what I think most of us have kept hammering home from Zachariah when he talked about social drivers of NCDs, that beyond you being able to go to a hospital, being the floor mopping, that if you actually have an NCD, you can access a service. There are all these other things that contribute to you actually living a healthy life beyond there being health services around. And so we have access to health-related education and information, what we keep saying. How do we get information on promoting healthy diets on the ground? Adequate supply of food. I mean, if there's anything to ground nutritional labeling, it's things like adequate supply of food and adequate nutrition. Because how do you get adequate nutrition if you do not know what adequate nutrition looks like and what nutrients are actually available in the food that you eat? You have healthy working and environmental conditions, adequate sanitation, access to housing, safe drinking water. These are all things that contribute to a healthy individual. But these are all things that aren't necessarily within the sphere of control of one individual. So, next slide. This is just a very brief overview of how the right to health is actually seen from as I said, a rights-based perspective. That beyond accessing health services, there are all these, I really do not know what the phrase is, like maybe branches in the tree or the roots. They're all the roots that anchor the tree that is a healthy individual or a healthy nation. And so quite quickly, Dr. Odwor went through this in brief, but I'll go into it a little bit more in depth around how specific constitutional provisions in Kenya can be argued, or can be leveraged upon to advocate for nutritional labeling. Because as we said, what are the existing tools that we have as we, quote unquote, wait for certain actions or certain interventions from maybe state actors? So of course, there's enforcement of the Bill of Rights. Basically, individuals have the right to go to court to claim that a right has been denied, violated, infringed, or threatened. So Patricia Sero, Kia Mtata, like these people, you can go to court, and the Wangare Maathai case was actually one of the sparks for this right for individuals, that you can go to court not just because your own right has been violated, but even the threat that something could violate your right. For instance, if they start a construction right outside my house and maybe there is deadly vapors, the construction haijaanza, But even the threat to my clean air is enough for me to go to court, because it could lead to a situation where my right is violated. So we don't have to wait for the rights to be violated to go to court. Like even the ukinusia tu na umbali, that is the time to nip it in the bud. Article 26(1) states every person has the right to life. We've had very disheartening statistics today around disability and NCDs being one of the leading causes of death, both worldwide and nationally. And unhealthy diets, as we've noted, was one of the, they gave 5 risk factors. Zachariah gave 5 risk factors, and unhealthy diets was in the top 3. And so one could argue, if every person has a right to life, then they have the right to choose or to know the food they're consuming, because the wrong food could lead to them getting a non-communicable disease, which is a direct threat to their life. Access to information. This one quite directly justifies the need for nutritional labeling measures, because access to information is all about having the information you need as a means to protect other rights. So if I need to protect my own right to health, I need to know the food that I eat, what's in it, what effect does that food have on my health status. Next slide, please. Article 43(1)(a), the right to the highest attainable standard of health. I won't go into it in more detail, but basically, as I've said, around the access to information angle, food information is really important, or nutritional information is vital in helping people make informed choices when buying, when consuming food. So telling pregnant women not to take an iron supplement because Royco will provide that iron, or telling children that eating Blue Band will make you taller, I mean, and having no way to disprove that, means that you're actually impeding on their right, both to have accurate information, but the right to highest attainable standard of health, because we know Blue Band doesn't make anyone taller. You become tall as per your genetics, and that is it. But even if Blue Band made someone taller, what even is in Blue Band that I should consume it every day? I've never just seen a random yellow substance in nature. So really, what happened? What's in Blue Band? So that I can make the choice and say, okay, let me, in a balance of priorities, nitakula hii Blue Band even though it has high fat because it will make me taller. I can't even make that choice because I'm not given the information I need. Article 43(1)(c), right to be free from hunger. Yes, that's actually a right within the Constitution of Kenya. And freedom from hunger includes having adequate food of, in fact, it says adequate food of that is safe and of acceptable quality. And so adequate nutrition and the idea of having safe food underscores the need for nutritional labels. So remember the cereals that we saw? One with a tiger looking all fun, and then the other that actually has a label that says high in fat and high in sugar. And this is connected to perhaps the issue of IP, that a label that we have doesn't necessarily have to say cornflakes is made with 1, 2, 3. It could be that our proposed front of pack is having warnings around the unhealthy elements of a food. So if it's high in trans fats, there is a warning label on that. We may not need to know the full ingredient list, but at least as a parent, as you're picking up that cereal that your child will eat every morning, then you're aware of what's going into your child's body. Article 46(1) or 46 in general, which are around consumer rights. And more than anything, I think nutritional labeling is grounded in both the right to health, but also in consumer rights, because it's about what a person consumes and how they can make the choice of what they consume. And so consumer rights note that consumers have the rights to goods of reasonable quality, the information necessary for them to gain full benefit from those goods. So if I actually need iron, I need the information necessary on what is a good source of iron. And then to the protection of their health and safety. And so I think this is one of the constitutional provisions that could be most heavily leveraged to push for nutritional labeling, because it's justified under this article as it protects the rights of consumers to actually have information necessary for them to make informed choices. And that's really what we are looking for at the end of the day. Next slide. Lastly, the best interests of the child. We really love children. Whether it's a Kenyan thing, an African thing, I do not know, but we love children. Article 53(1)(c), every child has the right to basic nutrition, shelter, and healthcare. And part of basic nutrition, again, is knowing what goes into the food that children consume. Next slide. So that's just a broad, really broad overview of how we could use, and I'm hoping that it's opening up your mind to see that while we may not necessarily have a law that is front of pack law, labels need to look like 1, 2, 3, 4, that there are still instruments, and I think that again was Dr. Udwar's one of his main points, that there are instruments, there are other avenues that we can leverage in our continued advocacy. And so it doesn't necessarily mean going to court immediately, but in the instance that, let's say, the ministry actually manages to pass regulations or guidelines, the voluntary guidelines on front of pack labeling, and then within that 3 to 5 year maximum cap, government hasn't taken the necessary steps to realize it, to make sure it's a mandatory law, then these are the sorts of provisions that we'd actually pull to go to court and say the fact that these additional steps weren't taken to ensure the food industry complies means that these rights are being violated. So it's all about opening up our minds to how the existing frameworks that we live under or that we use in Kenya do actually have some guidance and can be leveraged on to continuously advocate for nutritional labeling. So there are 2 cases here I'd like to discuss a little, just showing you again, and I think also part of the discussion with Kate on whether individuals or how corporate bodies are actually bound to follow the law, and that can be ensured because of individuals. So in this, Mark Ndumia Ndungu versus Nairobi Bottlers, Mark really liked your, inaitwangwa nini? That fat soda, the one in a glass bottle, we know it. I forget the name we like to use. But yeah, he really liked that soda. When it was festive season, you know how we all do. We'll all go to Coca-Cola bottlers, take all the Coca-Cola bottles we've had around the house because no one wants to pay the price of plastic bottles, go to a distributor, in fact, get at that low price. Because as Immaculate said, the price of soda does not go up. Go and get it at 23 bob instead of the 30 bob you'll get at a kiosk. So he really liked soda. He'd been drinking soda, and then he developed ulcers. When he went to get that treated, his doctors said he needs to stop consuming acidic foods and beverages, then gave him a list that included soda. Exactly. Did we know that soda is actually an acidic beverage? As per Mark's doctor anyway. So Mark, he, just as you guys were, yeah, that was also Mark. Aliwashwa sana that he was drinking soda near daily and it was having an effect on his ulcers that he couldn't have known about, because we've all seen what the glass bottle looks like. It's clear, it has the top and it just has that. It's not even a sticker that you can peel off. I don't know how, it's like almost painted on the bottle. There's no nutrient information, no ingredient information, and there isn't even contact information for the bottler company for you to contact and say, enye kuna kwanga na nini ndani ya Coca-Cola. And so Mark went to court, and this is where I tell you, individuals can go to court. Article 19 to 59 provides a lot of leverage for you to go to court. And Mark said that the fact that the plastic bottles contain a label that have contact information, which means that if you buy the plastic soda, you can contact Nairobi bottlers and know what's in your soda or what certain levels of acid are in soda. And it's not on the glass bottle, which is the cheaper alternative, is actually a violation of the right to information and consumer rights. And the court actually agreed with Mark, and it issued an injunction to Nairobi bottlers to ensure that the sodas that they were selling in glass bottles actually contain contact information and a few of the nutrition and the nutrient information. And so here you see that while we may be over-regulated, but imagine a scenario where we actually have front of pack, or we have certain regulations on nutritional labeling. Then in fact, the court would have had more power to say, even beyond having contact information, you need to have a high in sugar, high in acid warning sign on all your bottles. So again, seeing that these instruments are things that can be leveraged on, whether by courts, whether by individuals, to actually push for better enabling environments. So Mark aliashwa, and he won. Whether that happens in Coca-Cola bottles now, I cannot tell you fully. Or whether they all have contact information, I cannot tell you. But it provides a good basis for seeing that companies themselves can actually be liable when their actions are a threat to an individual's rights. So the second case, and this has been mentioned, I think, thrice now, British American Tobacco versus the Ministry of Health. It was the CS, the Attorney General, Kenya Tobacco Control Board. A lot of people walirushwa hapo. And as we've said multiple times, while civil society may not have the money to be in court for 9 years, manufacturers do. Food industry and tobacco industry, in this case, it had the money because it went from the High Court to the Court of Appeal. Like, if there was a possibility to have gotten to the Supreme Court, they would have paid that money to get there. So in this BAT versus Ministry of Health case, BAT was challenging certain parts of the tobacco control regulations. So these are regulations based off of the Tobacco Control Act, gives, the board certain powers to have regulations to, expand on certain parts of the Tobacco Control Act. And so some of the things that these regulations noted was that tobacco companies need to provide a 2%, I think it was 2% of their annual profits, to contribute to tobacco research and to cancer research. It limited and created now these smoke-free zones where children, there's smoke-free areas where children could easily access. On top of that, it limited the interaction between public health officials and the tobacco industry. So it actually limited freedom of assembly for the tobacco industry because it said, history ya kupeleka watu Mombasa, it's not going to happen. Or rather, it needs to be regulated because as we know, these are forums that are used by industry to lobby for certain things. And so it said the regulations actually limited the interaction that public officials can have with the tobacco industry in general. Also noted the need for those picture health warnings and disclosure of ingredients. So the tobacco industry was particularly impressed by the 2% that they needed to contribute to tobacco research, and by the regulations limiting interaction between public health officials and the tobacco industry. So they went to court, went to the High Court, argued that one, the regulations weren't made with adequate public participation, and I can tell you the Ministry of Health was sued specifically. The CS at the time was sued specifically under that argument that there wasn't meaningful public participation from the tobacco industry. They also noted that that regulation that limited their interaction with public health officials was both discriminatory because it's not applied to other industries, and also was impeding on their freedom of assembly. They argued there are other ways that government officials could be held accountable, or the industry could be held accountable, to ensuring that there's no lobbying or mambo ya chini ya maji happening when the tobacco industry meets public health officials. They also argued against that 2% annual contribution, saying it was almost like an unconstitutional tax. And so they went to the High Court and the Court of Appeal, and both these courts upheld the regulations as it is, or as they were. On the issue of the limitation of interaction between public health officials and the tobacco industry, the argument by the court and even by the ministry was that tobacco is known to be dangerous. Like we are all at that point where we know tobacco is a very cancerous substance, and so limiting interactions between an industry that markets a cancerous substance for profit and the public health institutions that are given the power to actually, regulate the health system in Kenya has a broader goal, and that's the health of Kenyans. That the right to the highest, that the tobacco industry's freedom is being restricted for the broader purpose of the right to health. And so we see that balance of rights start to come up because, and this is connected to what Steve asked around how do we balance IP rights. And in fact, that someone also asked around restrictions on marketing, of how do you balance the fact that media actually gets money or makes profit off of certain advertisements, and the fact that these things have an effect on public health. And in this specific case, the court noted that public health takes precedent. And so the regulations were upheld as they were. And so I think the tobacco industry is one of those lessons learned. You know the way HIV activists will tell you, if you learned lessons from the HIV and TB epidemic, then we'd have better structures for the COVID pandemic. In the same strain, if we start to see how the industry pushed back, anticipate some of the challenges that came out of tobacco regulation and tobacco control, then we can already start to foresee strategies that we'll need once we get to having actual front-of-pack labeling guidelines. That's why I think this conversation is happening at an optimum time, that there's nothing set in stone yet. We're all just preparing, and we're preparing to support government in their initiatives, because there will definitely be pushback. You can imagine if every soda bottle has a gigantic red sticker written extremely high in sugar, or have some sort of diseased-looking organ. Coca-Cola is definitely going to fight back against that. If there are restrictions on marketing where you're telling KFC that this story of all your KFC billboards being in Ngong Road and Kilimani, where coincidentally all schools are, that if you're going to tell them that marketing that they do that is quite effective, or telling supermarkets you can no longer place sweets and chocolates at the counter, and then make sure they're placed really low so that your children are right at eye level, wanaangalia your dairy milk tu iko papo hapo. there's going to be pushback from industries that have money and may be more coordinated than we are. So we're anticipating, by having sensitizations like this, we're anticipating when government actually, as I said, they're in the finalization of the nutrient profile model, that when they move into getting guidelines and having stakeholder consultation, we are also already mobilized and sensitized. That, yeah, manufacturing will, or industry, the food industry will come with their research that may or may not be true, but will also come with our knowledge. Will come with the knowledge of what we've been told in terms of statistics of NCDs, and the risk factor that is unhealthy diets will come with statistics on NCDs in Kenya, will come with the constitution, and talk about the need to balance the interests of corporate interests with a very broader interest of public health. So understanding these things, or at least being introduced to them, I think we hope that this is actually the first of additional, many additional engagements. Some of you may have been involved in RECAP before, but for those who aren't, this is just a good way to introduce you to the initiatives and the interventions that government hopes to pass, and start to see what role can you play in the existing system. What capacities do we have within the room? What capacities do we lack? And how, most importantly, how can we be ready once we get to the critical moments of things like stakeholder consultation? And we've already identified something, the food safety bill, something that we can all collaborate on and see how can we get our own perspectives informed by the right to health, by consumer rights, the right to information, and the statistics that we now know. How can we get our informed perspectives to Parliament? Sawa sawa. So the last slide, I think, is just some recommended policy actions. But I think most of them are things that government is already doing or trying to do. And so they're here on this last page of the policy brief, the recommendations. So I won't necessarily go through all of them because, as I said, this isn't necessarily about saying government should do 1, 2, 3, but about us being aware enough, or raising our awareness and creating knowledge around this issue so that at the critical moment, we are prepared. Sawa sawa. Hiya, thank you all for listening. I think if you have any questions, comments, reflections, sadly my laptop has gone off so I can't monitor the chat. But Timothy, if you could, yes, thank you. So any questions, comments, reflections? Yeah. So I'm hoping the chat and the room is quiet because we're ruminating, that we're letting it sink in, so that the next time we actually come together and meet, we're at a better position to actually come up with more concrete ways of engaging with these issues. But yeah, still, I'll just leave the floor open for a few more. Steve?
Thank you very much, Lisa. I think that was wonderful and well done. My comment is that on the recommendation part, we've just put in the recommendations that what we want the Ministry of Health to do. I've not seen what we as CSO, I think I was expecting to see maybe like 3 or 4 bullets that we as CSO should start. And I think one recommendation that I should put in the panel is that we need to come up with a structured and leadership way of CSO that will lead this discussion at that level. Because I know Kelin is a good organization that is engaging parliamentarian, but we need to come in and say, yes, we've given Kelin the mandate to represent the civil society at that discussion. That's my input. Thank you.
Thank you, Steve, for that. Before I comment on that, are there any other comments, questions, reflections? Okay, so the recommendations here are policy-based because it's a policy brief, but we are quite, of course, intent and invested in having strong or strengthened multi-stakeholder collaboration towards pushing all of these things. And so, as I've noted, we will have yet another sensitization forum on restrictions on marketing, where we'll tie some of the things, some of the questions that were being asked today, this issue of when advertisements air, where they are placed, whether there's anything regulating that, and etc., and start to see what roles. I think before this was done, this sensitization forum was done with the understanding that before we get to roles, we need to understand the current environment. And we also need to know each other. Like now we know Immaculate is the country lead for RECAP. We know what RECAP is. We know Scaling Up Nutrition, or SAN-CSA, is involved with a parliamentary nutrition caucus. I think within the chat we saw a lot of very good reflections from a number of stakeholders, like Celine from the Institute, from ILA, the Institute of Legislative Affairs, or from, I saw a Machakos County official as well, asking quite a number of good questions around restrictions on marketing. So the point of this forum was to start to bring us together and put us in this mindset that you're actually proposing, that how do we coordinate, what roles can we all play as we are in the room, what capacities do we have, and how do we all build or contribute to meeting this same goal. And so we will have another sensitization forum, but we also have ongoing a number of other initiatives led by other partners. So we have RECAP technical working groups that some of you are involved in, but if you're not involved in, you can feel free to shoot us an email and we can see how to connect you to the relevant partner. And so, like for Kellen, was based on legal and policy work around nutritional labeling and restrictions on marketing, but the Institute of Legislative Affairs is really doing some good research work around sugar-sweetened beverages taxation. So the fiscal part of the global regulatory and fiscal capacity building. So if you're interested in knowing more about the research they're doing research around consumption of processed and ultra-processed foods. They're connected to the University of Cape Town that's doing a sort of knowledge sharing on sugar-sweetened beverages taxation, because that has been successful in South Africa. And so there's that opportunity for lessons learned and for experience sharing with another African country. There is African Population and Health Research Center that's also doing research that could contribute to any advocacy. As Dr. Odwor said, the evidence generation aspect is also quite necessary to back our advocacy. So we are also working in a web, or like in a tree of partners. We're just one branch, but we do have partners that are leading in other efforts. There is still, of course, the national RECAP program that's ongoing. There are opportunities that maybe each of the civil society or the academia or the government actors in the room are aware of. So I think if we could come up with one, which I would suggest being knowing this food safety bill, what the contents are, and where it's at, whether it's still the food safety, or rather whether it's still the food and drug. Yeah, food and chem. And so we've already had one commitment that we'll get the contact of the mover of the bill, and then from there perhaps we could approach Scaling Up Nutrition Civil Society Alliance, because they are an alliance of organizations focused specifically on nutrition issues. So the opportunities are already starting to show themselves. But as I've said, this isn't going to be the only time Kellen engages us. If you want to continuously be engaged within this space, we're quite happy to try and find ways to do so within each of our capacities. Hi, any other questions, comments? Okay, great. So before I invite Immaculate to give our closing remarks, I think we should all stand up and clap for ourselves. I don't know. Steve, I feel like you'd know a coordinated clap.
That is the disadvantage of being loud. So I would like us to clap a wheel of clap. So I will be moving the wheel as you clap. As you clap, we'll start slowly as the momentum goes on until I stop. So let's start. Yours is to clap. Mine is to move the wheel. Good.
Thank you, Steve. I feel like you should remain standing because Immaculate will definitely ask us all to stand. So you should just remain standing. But from the Kellyn end, we just want to thank you all for honoring our invitation. I think we personally are quite surprised by the turnout, both virtually and physically. I think we managed to get over 50 continuous participants, and that's a significant number of actors to be introduced within the space. So as I've said, the door, metaphorical door being our emails, are open. We've shared I think you've definitely seen Catherine's emails or Timothy or myself, that these are quite open for you to breach any of these issues that you're saying, whether there are other ways that you'd like to be engaged within the projects or within the space. We'll be sure to share the presentations and to share the report once it's done so that you also have a chance to read through it again and internalize everything that we've done today. So thank you all, and Immaculate, the floor is yours.
Thank you very much, Lisa. You are a wonderful speaker. Good afternoon, good evening. Yeah, good evening. I'm so grateful that I'm here to just stand before you going home. It is just me. My work has been made easy because we know Nairobi is very packed at that time, and priority changes when it becomes a time like this. But above all, I want to thank you through your organization who were able to release you to come here, to come and listen to these thought processes that are going through. I want to thank Kellyn for this sensitization meeting, which would have not, in fact, this is the right time that it is coming. I know Kellyn will say that we'd have even done it earlier, but I kept telling them that please give us time so that I can prepare something to come and talk about. Because even as we are learning, this is something which is new. We are learning. In fact, we are counting some few African countries that are coming up with front of pack labeling. So all of us are in process of learning. And so I felt like I've learned something. I have learned a lot, that now this meeting, we can come to a round table and start talking about front of pack labeling. I am sure you guys have also learned. We have learned a lot. If you ever forget anything that was discussed around front of pack labeling, please remember, after every 30 minutes, wherever you are, please stand. The only time that you're allowed is when you're sleeping. It's not even a joke. By the way, the multinational, I tell you, I have a friend who works with the Coca-Cola company. They have gadgets in their laptops which tells them stand. And if you don't stand, the laptop will close. It's made in such a way, my watch tells me, stand and give me 100 steps. So even if I had to stop there, I'm just doing like this so that I'm able to keep myself active. WHO, you remember the way they were. Any workshop that they are in, even if it's not in their country, I don't know how their office operates, but they have the standing tables for work. I am telling you, let us take our responsibility, the responsibility on our hands. I am a Christian, and I remember when Daniel was in Babylon, he refused to eat from the king's table. He said, I will never defile myself. Whatever goes inside my mouth, I have to be the one who is sure of it. So can we take the responsibility of whatever you are eating? Did you get involved in preparation? Do you know what it has? What content is in it? I always drive, sorry, I've not started closing. On Bagadi Way, there are some business people, I call them business people because at least they have service they are doing. They sell crisps, which are packed. And even if you look at them, they look so oily inside those clean peppers. I ask myself, gosh, do they know what is this they are selling? I wish I could even ask them, do you eat yourself? You who is selling? But of course I can't ask because really, you know, people come from different backgrounds or wanaweza kuwa wameamuka the other side of the bed. So never asked somebody, anauza, congratulate them. Okay, on behalf of the office that we serve, we are so grateful, and the road has been opened for us, the door has been opened for us. We are going to talk about front of pack labeling as a tool that helps the government to implement. One is that constitution, that right. It says that whatever you are consuming, you have a right to know. So declaration will go on. We are now the steps that we are going to select the specific strategy which we are going to use on front of pack. And if you have an idea from the learnings that you have had, if you have an idea which you can also help the government, please share with the email address at Kelin. Our government email address also is open. Even nowadays, even if you send anything on Ministry of Health Twitter handle, it will be acted upon. So we are also going to select the symbol of how, remember what I think Kate Robertson shared, that there are some octagon, there are some red, there are some things which are written. These are now what I have learned that we need to consider and decide. And if you have any that you think may work for the government of Kenya or you may like, then you can share those ideas. We are going to also consider setting up the nutrients declarations that are going to be there. What is it that they are going to write? For example, if you look at that water, there are several nutrients that are written, but we are going to think about having the mandatory nutrients that must be declared in any packaged foods. So this system, we think, will be contributing towards reducing the NCDs and also ensuring that our population has the responsibility of getting to know whatever you are consuming. Governments will also have developed messages to go with it. Messages like it will not be front of pack labeling alone. We will have a lot of reformulation and messages that educate the population that maybe if your crisp will have less oil, then it may not taste the way it used to taste. So that kind of IC materials shall be available for the public to know. so up to there for us. We are so grateful. We are so humbled by this step that you have just made, and we shall continue meeting. I know you still have some steps that you're making. I hope attendance will still be as good as this one. Thank you so much. And we are told that let us limit clapping, just in case there was COVID.
Yeah, so I think with all that, we can declare this meeting officially closed. I know Nairobians get very antsy at 4:01. That traffic is definitely not a friend for anyone. So for our virtual participants, thank you all for joining. Thank you for your consistency throughout. As Timothy has noted on the chat, we'll be sending an email with a DocuSign link so that you can receive data reimbursements. For our physical participants, I hope you signed both the attendance list and the transport reimbursement form that my colleague Catherine was. She sat outside here and had you all sign, so I hope you have signed. Make sure that you have signed the transport reimbursement form. You'll be receiving these over M-Pesa within the week. Sawa sawa. Hi, thank you all for attending. Please go home to your families and make sure to meet your 5 servings of fruits and vegetables.